The North Tees and Hartlepool Trust got the junior doctors involved, and through that we were able to help as many people as possible. But it's because the Trust worked so hard to get all of the trainees involved that we were able to help the recovery trial in recruiting these patients. Without the large quantity of juniors that were involved, we wouldn't have been able to do so otherwise.
The recovery trial is a national high priority randomised controlled trial coordinated by Oxford University, and effectively is designed to assess potentially useful treatments for patients who are unwell enough with COVID to require hospital treatment.
In our trust, the senior team of consultants and registrars and research nurses got us involved very early on. We had training and an induction pretty much right at the start of the first lockdown, and we were told and given the responsibility to consent patients for the trial, and then with help from and senior support we were able to start them on the appropriate treatment following randomisation.
But we didn't have any evidence that any of these treatments would be definitely beneficial to a patient. And the only way to work that out is to perform research. So what we really wanted is to get as many people as possible involved in research at a very, very early stage in the pandemic. So as we move through the pandemic, we would start to get answers about what treatment is best for my patient.
I think that firstly, there was a big push for trainees to take charge almost of the patients, and to get involved because this is such groundbreaking work, and the seniors were very clear that we need to be involved from the get-go, and by doing that we were able to help our patient.
And already the recovery trial has been able to do that, so it's been fantastic at getting patients in quickly. We now know that there is a medication, a steroid medication called dexamethasone, which is fantastic at reducing the chance from dying from severe COVID. To now that is a standard part of a patient's treatment as they come through a hospital. So we've gone from something that was a possible benefit to now a standard bit of clinical care within this pandemic, and I think that's sensational.
So I think one of the reasons that we were able to recruit as many patients is because there was such a push, and all of the junior doctors were involved, all of the junior doctors were trained, and all of the junior doctors were consenting patients. So by recruiting a large number of patients in the trial, that meant that we were able to give more patients different medications, and through that we've been able to work out which medications have actually offered a benefit.
We've been one of the best performing trusts in the country, getting the proportion of patients admitted with COVID involved in the recovery trial. But without the junior doctors, we would not have been as successful as we were.
Training has been so good because of the senior support, and they're all very keen to teach and get you involved. And I think that as a trainee there's a bit of a balance between service provision and also teaching, but they strike it really well here in that they offer trainees the best possible chance of doing as much as possible, and at the end of the day ultimately they want you to become better so that you can help your patients.
So I'm really proud that when doctors in training come to North Tees and Hartlepool, and also the North East and North Cumbria, we give them fantastic opportunities for hard clinical work, but lots of exposure to different clinical situations, but also get involved at research at very early phases, and not just having to do a time out of specific research later on during their career.